that you're spending time with your family, enjoying your hobbies, and savoring the peace you've worked so hard to earn. But there's something that could disrupt that peace. Medicare fraud. Every year, thousands of seniors fall victim to scams that target their Medicare benefits. These aren't just harmless pranks. They can drain your savings, steal your identity, and leave you feeling vulnerable. Scammers can be convincing. They can make you believe they're helping you. But you don't have to face this alone. By learning what to watch out for, you can protect your hard-earned benefits and keep your peace of mind. Because your golden years should be about joy and not fear. And together we can make sure they stay that way. Let's take a stand against Medicare fraud. Because your security matters. And so does your peace of mind. Welcome to your community. Vivek's Wealth and Insurance Solutions, together with Secure65 Health Plans, where seniors thrive. Protecting yourself from Medicare fraud and what to watch out for. We are your senior advocates, Alicia Alcano and Monet Swan. No senior should ever enroll in Medicare with a stranger. Secure65 Health Plans, where seniors thrive. Vivek's Wealth and Insurance Solutions. Welcome.
Another fabulous day. Hello, everyone. Hi. Welcome. It is an honor to have you with us for today's webinar, Protecting Yourself from Medicare Fraud. And I am privileged to be your host today alongside my cohort, Alicia Alcano. Thank you for choosing to spend your time with us. Allow me to share a little bit about who we are and why our work resonates so deeply around the world. I bring over 26 years of experience in management, spanning the legal, finance, nonprofit, and insurance sectors. Throughout my career, I have served as a personal advisor, business consultant, and insurance trainer, guiding more than 3,000 agents nationwide. My journey has been blessed, and it has given me the opportunity to work alongside a truly diverse group of individuals. People of all ages, from seniors to young adults, across a wide spectrum of economic backgrounds and ethnicities. I've heard the privilege and had the privilege of collaborating with entrepreneurs, small business owners, corporate leaders, and professionals at every level. So today, we're going to talk about how this rich tapestry of experience has deepened my understanding of the unique needs and aspirations that drive each and every one of us. And it has reinforced my commitment to serving and supporting a community as beautifully diverse as ours. So before we go any further, I'm going to share with you that unfortunately, Alicia Alcano will not be with us today. She's having a little technical issues. However, we will be happy to see her join us again next week. So we're going to start right in with today's crucial session, and it's about protecting yourself from Medicare fraud. Because as we age, staying informed and vigilant becomes more important than ever, especially when it comes to safeguarding our Medicare benefits. Fraudsters are becoming increasingly sophisticated in their tactics, targeting seniors with schemes designed to steal your personal information, drain your resources, and disrupt your access to essential healthcare. So in today's webinar, we'll not only discuss the most common types of Medicare fraud, but also empower you with practical steps to recognize and prevent these scams in the future. Our goal is to ensure that you feel confident in protecting yourself and your loved ones from falling victim to these deceptive practices. Your safety and peace of mind are our top priorities, and we're here to support you every step of the way. And then we'll walk you through the common types of Medicare fraud, the warning signs to watch for, and the steps you can take to safeguard your personal information. At Bivix Wealth and Insurance Solutions and Collaborative Expansion, our mission transcends merely offering options and support. We are deeply committed to fostering a community where every individual, regardless of age, ethnicity, or need, feels valued, respected, and protected. Our work let's say it this way. Our work is rooted in a steadfast dedication to creating a nurturing environment where all members of all diverse communities can thrive. For our seniors, we have established a dedicated division at Bivix called Secure65 Health Plans, where we prioritize their well-being, ensuring they are shielded from fraud and deception. We believe that our elders deserve nothing less than love, dignity, and the utmost respect for the contributions they have made throughout their lives. Our mission is to provide a golden map that guides each of you through your golden years, revealing a path that's uniquely tailored to your pursuit of happiness, health, and financial security. But our commitment extends far beyond words, because at Bivix, we do not tolerate fraud, and we are ever vigilant, ready to assist you in taking the necessary steps to protect yourself. So whether it's reaching out to the proper authorities, safeguarding your identity, or guiding you through the process, we are here to offer hands-on support whenever you need it. So as we continue forward, I want to make sure that you understand that what this looks like today is going to be a kind of a capsulated view as to what's going on in the market as far as protecting yourself, your Medicare, what you should do to be able to go through the process easy and not be afraid of things that could happen. So we're going to start with an introduction to Medicare fraud. We're going to then go into common types of Medicare fraud, then warning signs and red flags. Then we're going to touch on practical steps to protect yourself, testimonials and statistics, as well as community and social media resources. And then we're going to conclude with some best steps and some wonderful merchandise that you can also use. So let's get into it. All right. So, as you know, as we stated, Medicaid fraud is a pervasive and growing threat, impacting the lives of millions of seniors across the country. According to the National Healthcare Anti-Fraud Association, Medicare fraud costs in the U.S. government and taxpayers are paying an estimated $60 billion annually. This rampant use or abuse not only drains essential resources, but also directly endangers the well-being of our senior population. So when someone uses your Medicare information to steal money or gain unauthorized benefits, they are not just committing a crime, they are potentially jeopardizing your access to the care and services you need. The consequences can be severe, ranging from being billed for services you never received to being denied legitimate Medicare coverage because your benefits have already been exhausted by someone else. So unfortunately, seniors are often the primary targets of these schemes, with fraudsters exploiting vulnerabilities such as cognitive decline, lack of awareness, and isolation. The gravity of this issue cannot be overstated. A recent report by the Office of Inspector General found that more than 1 in 10 Medicare beneficiaries report experiencing potential fraud in the last year alone. Now, this is a sobering statistic, underscoring the urgent need for vigilance and proactive measures to protect yourself and your loved ones from becoming victimized. Awareness and education are your first line of defense. By understanding how Medicare fraud operates and taking the steps to safeguard your information, you can play a crucial role preventing this crime and ensure that your Medicare remains a trusted resource for all seniors. And I'm thinking Alicia is going to join us. No, I think she's still having some technical difficulty. Okay. So fraud is not something that just happens to a select few of us, you guys. And it doesn't only put your personal finances at risk, but also leads to higher healthcare costs for everyone. Understanding how it works is the first step in protecting yourself. Medicare fraud is a serious issue that impacts both individuals and our healthcare system as a whole. It occurs when individuals or organizations intentionally deceive Medicare to gain unauthorized benefits or payments. Well, this can include such as billing for services that were never provided, falsifying diagnosis, or misrepresenting the nature of the treatment. Medicare fraud not only undermines the integrity of the healthcare system, but it also diverts crucial resources away from those who genuinely need them. So understanding and identifying Medicare fraud is essential in safeguarding the program's resources and ensuring that beneficiaries receive the care that they deserve. So let's talk about some of the common types of Medicare fraud. One of the most common is the fraud of billing for services or equipment that you never received. Scammers may also push unnecessary tests or procedures. Other fraudulent practices involved falsifying patient information to obtain unnecessary treatment or prescriptions, and using another person's Medicare information to access benefits unlawfully. Now, these fraudulent activities not only result in financial losses, but also compromise the very quality of care and trust that the Medicare system provides. So we're going to go over some of the many ways your path may cross with fraud. And some of these occurrences we are going to say a few times. Let me say that a few times, because I want to make sure it sinks in. When I was studying for my Series 7, I had a teacher who would say the most important information 3 times to emphasize its importance. And I find that this is a good practice when learning new concepts, new ideas, and new information. So let me say this. These fraudsters are getting super clever, and it's crucial that you stay one step ahead. So let's say you're reviewing your Medicare statement. Now, when you think about this, you think, well, how do I get access to it? Well, you can get access online, or you can wait for the statement to come out. It comes out every 3 months. And if you see a charge for a wheelchair, you need to think about it for a minute and then say to yourself, well, I don't need a wheelchair. I didn't order a wheelchair. And where did this wheelchair charge come from? You guys, this is a common occurrence, much more common than what you think. So let's talk about how you can protect yourself. When it comes to number one, someone might be using your Medicare information to bill for DME, also known as durable medical equipment, or even services you've never asked for. Remember, your Medicare card is like a credit card. So if you see something like this, please don't ignore it and think it's not a big deal, or maybe somebody just made a simple mistake. Why, you ask? Well, because when you need one, you may not be able to get one because someone used your Medicare number and they already got one. Common occurrence number 2. Now the phone rings and you get a call from someone offering, let's just say, something for free. They may say, just give me your Medicare number and we'll send you this free medical alert system. Or what about free genetic testing kits? These scams have been going on for years and they're becoming more prevalent in the recent years. Scammers are now targeting seniors by offering free genetic testing kits, purportedly covered by Medicare. You guys, please please, please reserve these conversations and concerns for appointments with your trusted medical service providers. And remember, when it sounds too good to be true, typically it is. Another common occurrence is called the open enrollment scam. And this is a 1 and 2 part scam. The first part, they will call you and say, you know what? I just wanted to make sure that you've got all the information that you need to be able to enroll. So how do they do it? Well, in the scammer's mind, it's birthed and used by individuals and companies that are impersonating your provider with fake websites and emails designed to mimic legitimate Medicare or healthcare portals to trick you into divulging your personal information. Now, they may incentivize you by claiming there is a free or better plan. However, there have been also reports of links being sent to Medicare beneficiaries stating the Medicare recipient recently overpaid. Okay, you're going to get this thing that says you have overpaid for a service and is now owed a refund, subsequently requesting that you simply enter a bank account information to receive these funds. It's terrible. And these scams often appear convincing and may include urgent messages prompting you to take action immediately and verify your identification and or your payment information. Now, if that's not bad enough, there's also a part B to this scam. And the part B includes scammers impersonating insurance agents or healthcare professionals in convincing ways to obtain personal information from any and every Medicare recipient they can speak to. They may claim there is an issue with your Medicare coverage and request sensitive details to resolve the problem or offer you a way to enroll early. So pay attention to this story because this is happening every day. It's a lot more common than what you may think. So I'm going to tell you a little story. We call it the Helen story to see how she dealt with it. So one quiet evening, Helen sat alone thinking of her late husband and how much she missed his help with all the Medicare information that now fills her mailbox. As she went through the mail, the phone rang, and a friendly young man offered to help her enroll in Medicare early before the rush. Feeling a little unsure, Helen listened. She gave him a chance. When he asked for her Medicare number, something just clicked. She remembered her trusted agent who always contacted her in October. She responded with, "I have an agent," she told him. The man became insistent, asking who her agent worked for. Well, unfortunately, Helen couldn't remember the company name, but her instincts told her something wasn't right. So she quickly pulled up her landline and called her daughter, who told her to hang up the phone, "Mom, right now. Do not share any more information." Helen's quick thinking saved her from a scam. And unfortunately, many seniors face similar situations alone. At Bivix, we ensure all enrollments are handled by trusted professionals, and we show you how to get on the do not call list right after the enrollment. You can put us on speed dial because you have a senior advocate's cell phone to give you that added protection that someone is only a phone call away. We protect our seniors because your trust and safety are our trust and safety, and that matters the most to us. So remember, the minute someone asks for your Medicare number in exchange for a free service, hang up. Legitimate providers don't operate this way. Or maybe you're on the phone with someone who's pushing you hard to choose a Medicare plan right here and right now. You got to do it right now. They might even get upset with you if you're hesitating. Hang the phone up. Medicare agents don't rush decisions or pressure you into anything. If someone's trying to force you into a decision, it's likely a scam. Medicare will never call you to sell something or make a surprise visit to your home. And again, please guard your Medicare card like it's a credit card. Your Medicare card can be used and misused as if it were a credit card because it has valuable information that you can use and so can someone else. So the moment you notice your card is lost or stolen, contact Medicare and report the missing card by either reporting online or calling Medicare directly at 1-800-633-4227. Medicare will never, ever call you out of the blue asking for this information. So if something feels off, you guys, please just listen to your gut, listen to your instinct, trust yourself. If it feels wrong, it probably is. Your vigilance is your best defense. So stay alert, protect yourself, and if anything seems suspicious, well, report it immediately. A matter of fact, the Federal Trade Commission reports that nearly 20% of identity theft cases in the U.S. involve the misuse of medical information, with Medicare beneficiaries like you and like me. Well, we're all prime targets. So protecting your Medicare information is crucial to safeguarding your benefits and personal security. According to the Centers for Medicare and Medicaid Services, also known as CMS, Medicare fraud costs that we talked about earlier, costing taxpayers more than $60 billion a year, is becoming a significant burden to our state and to our country. We just cannot continue to allow this type of fraudulent activities, such as billing for services not provided, falsifying medical records, and exploiting billing codes for higher payments. Beyond the immediate financial losses, these schemes undermine the Medicare system, potentially diverting funds away from essential Medicare services that affect the quality of care for beneficiaries. Addressing Medicare fraud is vital to protect taxpayer dollars and ensure the program's sustainability and effectiveness. So now that we've done that, we're going to go into a little bit more about what do these warning signs and red flags look like. Okay, so when that scammer requests information, your mind will not say, oh, right over here, I'll take it. Oh, is it free? Oh, how can I get it? No, 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 no. Your mind is going to say, not here, not now, and not ever. It's crucial to take proactive steps to protect yourself. And remember, you are part of the whole. So what affects one senior affects us all. So when you receive unsolicited calls or emails, well, if they're asking for your Medicare number, treat it as a serious red flag. So let's start with number one. When you get that call, hang up immediately. Legitimate organizations will never cold call you to ask for personal information. Red flag number two, do not respond to any unsolicited emails requesting your Medicare details. You may not be able to distinguish whether the email is authentic or not. Instead, mark them as a spam and delete them. And never, 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 ever click on links or downloads. Do not download any attachments from unknown sources. That opens your computer to bugs and viruses and all kinds of things that you just can't take back once it's started. Number three, register your phone number on the National Do Not Call Registry to reduce the number of unsolicited calls. If you continue to receive suspicious calls, consider using your call blocking feature on your phone. So remember, guys, we talked about smartphone technology just a few weeks ago, and that video can be found 24 hours a day on this YouTube channel. So utilize it. And there's a lot of other good information on there as well. Next, number four, report the incident to Medicare by calling 1-800-MEDICARE. And if you'd prefer to have the numbers, it's 1-800-633-4227. Reporting helps prevent others from becoming victims. And number 5, be cautious and verify the identity of anyone who contacts you, even if you think the person is from our office. Have a code or a number to make sure. Last year, an agent from another agency claimed to be with us. He convinced the client to change her supplement policy to one with a gym membership and groceries, when it wasn't the best option for her based on her particular circumstances and health condition. Thank goodness she called to ask a question and was told that the agent wasn't with our agency and that she wasn't in the best plan for her specific situation. We enrolled her into another plan and made a formal complaint. So don't worry if you discover that you enrolled with the wrong company. We will be more than happy to get on a 3-way call with you and the carrier and get everything straightened out for you and with you. Unfortunately, there are also licensed Medicare agents who are just as bad as the scammers. Hate to say it. And so you should always enroll into a Medicare plan with an agent you know or someone you have interviewed. Interviewed. What a concept. You interview for a job. Why don't you interview somebody who's taking care of your health? Really important. So we welcome phone and Zoom interviews. We want you to feel comfortable that you are with the right agent at the right agency. So when in doubt about anything, call us and we will get everything straightened out. You can also contact SMP's Senior Money Purchase Program. They can help with questions, concerns, or even complaints about potential fraud and abuse issues. By taking these steps, you not only protect yourself, but you also contribute to the broader fight against Medicare fraud. So watch out for bills for services you don't remember receiving or pressure to get some free equipment. There's nothing free. These are all signs of potential fraud. Be vigilant. For warning signs of Medicare fraud, such as unexpected or unfamiliar charges on your Medicare statement services or treatments that you did not receive, or discrepancies in your personal information, are definitely red flags. Red flags can also include pressure from providers to sign forms or accept treatments that you don't understand, or receiving unsolicited offers for free services or equipment. If something seems off, it's important to report it to Medicare immediately to protect yourself and ensure the integrity of your benefits. Now, we've spoken with countless seniors who, through keen awareness and quick action, successfully avoided becoming victims of Medicare fraud. But there are a few more schemes coming down the pipeline. One is called the COVID-19 vaccine fraud. So scammers may pose as a healthcare provider or government official offering early access to COVID-19 vaccines or booster shots in exchange for, you guessed it, Medicare information or payment information. Now, then there's the telemedicine fraud. Telemedicine fraud. Keep this in your mind because a lot of people are using it. The telemedicine fraud, where seniors may receive unsolicited calls or emails offering free telehealth consultations or medical devices covered by, you guessed it, Medicare. And then there's the genetic testing scams. And we're more likely to see so many more scams for this year's annual enrollment. So pay attention to the signs we just discussed and stay alert, and you can protect yourself from becoming a target. So let's talk about some practical steps now. So to protect yourself, number 1, never give out your Medicare number unless you're sure who you're dealing with. Regularly review your Medicare statements and your explanation of benefits, which is also known as your EOB, for any discrepancies or unfamiliar charges. Any charges or changes, always safeguard your Medicare number and avoid sharing it unless absolutely necessary. Be cautious when accepting offers for free services or equipment. and verify the credentials of any healthcare provider before receiving care. If you suspect fraud, report it promptly to Medicare at 1-800-447-8477 or the Office of Inspector General. Taking these practical steps can help ensure your Medicare benefits remain secure and intact. Now, as I mentioned earlier, you should always review your Medicare statements. But if you are new to Medicare, well, let me tell you a little bit about how they work. So when you get them, you need to know when to expect them, how to review them, and how to stay on top of what is going on with respect to your Medicare billing. So Medicare sends out statements at different frequencies depending on the type of statement. Medicare Summary Notice, known as MSN, is mailed every 3 months to people with original Medicare who received services or supplies during that period. So if you received anything, you will get something within that 3-month window. It shows what services were billed, what Medicare paid, and what the patient or other insurance is responsible for. So it gives you some really good information. People can also sign up for electronic MSNs and receive an email with a link to their MSN each and every month. Medicare Premium Bill is also known as the CMS 500. Now, this bill is sent around the 10th of the month for Part A and Part B premiums. The due date is the 25th of the month, and you can pay your bill online by signing up with Medicare Easy Pay, by using your bank's online bill payment service, or by mailing a check, money order, credit card, or debit card. I don't think there's anything else left, right? Medicare Summary Notices can help people prevent fraud, confirm that they received all their services, and track your out-of-pocket expenses. They can also be used to document medical expenses on tax return. I think that's wonderful, and I think it helps keep us organized, if you know what I mean. Now, remember, Medicare only mails MSNs every 3 months, but you can also view your MSNs 24 hours a day by visiting mymedicare.gov. Registering for access to Medicare's free, secure online service allows you to review all bills processed within the past 36 months. So you can go back 3 years and you'll be able to see all those bills. Now, these simple yet crucial steps can be your first line of defense against fraud. So take the time to look into any unfamiliar charges, like services you didn't receive or discrepancies in the building. Even the smallest inconsistency could be a red flag that someone is trying to misuse your Medicare information. And again, if something doesn't look right, don't hesitate to contact Medicare immediately. There's nothing wrong with that. You can reach Medicare directly at 1-800-MEDICARE, or again, 1-800-633-4227. Alternatively, you can email your concerns to Medicare Fraud at cms.hhs.gov, or contact Senior Medicare Patrol, also known as SMP, either online or by calling 800-488-6070. Reporting suspicious activity as soon as you spot it can prevent further unauthorized use and protect your benefits from being compromised. Now, I got to say this. This webinar is not meant to scare you. In fact, it's meant to empower you by giving you the necessary tools so that you can protect yourself from becoming a victim. And I also want to share one more story with you because I think this is also a good one. Let me share the story about Mary. This really drives home the importance of vigilance. Mary, like many of us, always made it a habit to review her Medicare statements carefully. One day, she noticed something that didn't sit quite right with her. There were charges for medical equipment she never ordered, things she never would even need. It was a wheelchair to be exact. And Mary, who was in good health, knew immediately that something was wrong. At first, like all of us, she kind of felt like there was something confusing going on. And did she order it? She hadn't even been to the doctor recently, so she just kind of brushed it off, assuming that it was a clerical error. Mary trusted her instincts and decided, I need to pick up the phone and call someone. So she called Medicare immediately to report the charges. That one simple action not only stopped the fraud in its tracks, but also protected her benefits from further unauthorized use. Mary's quick thinking prevented the situation from spiraling into something much worse, potentially jeopardizing her access to the care she actually needed. So Mary's story is a powerful reminder that you are your best advocate, you guys. By staying vigilant and acting on those gut feelings, she safeguarded her future and her health. If you ever notice something unusual or feel like something just isn't right, don't even hesitate to take action. Just like Mary, you can protect yourself and your benefits from fraud. Whew, that was a lot of great information. But now let's kind of lighten it up a little bit, right? Let's lighten it up a little bit. So what we do on our platform is something that we do across every platform in the universe, even in the multi-universe. We are building connections that matter, bringing people together to thrive. Whether you're engaging with us on your favorite app, participating in a virtual conversation, or simply just living your day-to-day life, we are here creating a network where everyone is welcomed and valued. In a world that often feels divided and polarized, there is something profoundly powerful about finding a place where love, support, and unity are at the heart of everything we do. This is the community where you want to be, a place that not only welcomes you, but lifts you up. We stand together with you to navigate life's challenges and celebrate its joys. But this isn't just any community, you guys. It's one that is vibrant, growing, and deeply committed to the well-being of every member we have. We have the resources, the knowledge, and the passion to show you what it truly means to thrive in a supportive environment. So why look anywhere else? Let's do it right here. Let's do it together, where you're looking to connect. Whether you're looking to connect, to learn, or simply be a part of something bigger than yourself, we're ready to welcome you with open arms. So do you want to know more? Then join us. Let's create a thriving community together. Wherever you are in the universe, we're there with you. So now that you know how to connect with us on social media, stay informed about our latest in Medicare fraud and prevention by following us on Facebook, YouTube, and LinkedIn. And I want to show you one of the things I'm very proud of. Dun, da, da, da. Can you see it? Can you see it? Can you see it? Get that out of the way. Our merchandise. It is fabulous. By joining a fabulous little hat. Did I get that in the camera? Yeah. Someplace to put all your Medicare notes. Life, health, whatever. I love it. And you can't do it without one of our fabulous pins. Says Secure65. I'm not Vanna White, you guys, but how can you feel like a community without that? We make sure that you have things that make you feel good about being with us, because we feel good about you being with us, and we want you to feel the same. So to recap, Medicare fraud is a serious threat, but by being aware of the common types, watching for the warning signs, and taking those practical steps, you can protect yourself. Medicare fraud involves deceptive practices aimed at illegally obtaining Medicare benefits or payments. such as billing for non-existent services or falsifying patient information. So to protect yourself, regularly review your Medicare statements, safeguard your Medicare number, and be cautious when unsolicited offers come your way. Promptly reporting any suspicious activity helps you and it helps the Medicare system. So I want to thank you for being with us today. It has been such a pleasure. I want you to remember that staying informed is the best defense against fraud. If you need assistance, please reach out to us and talk to one of our senior advocates at 833-300-4968. In closing, I want to leave you with this thought. Your future is not determined by chance, but by the choices you make today. Take charge and implement what you work so hard to build. Together, we can fight Medicare fraud, and we are here for you. So guess what? Stay happy, stay healthy, stay golden. I'm Monet Swan. See you next Thursday. Same senior channel, same senior time right here on YouTube. Have a fantastic day. Bye.
As we journey through life, we've gathered wisdom, cherished memories, and strong bonds with those we love. But today, more than ever, it's vital that we protect these treasures. Our peace of mind and our health from those who seek to take advantage of us. Medicare fraud is not just about dollars and cents. It's about safeguarding your well-being, your trust, and the security you've worked so hard to build. Remember, your vigilance is your best defense. You are not alone in this. Reach out. Ask questions. And don't hesitate to seek help if something doesn't feel right. Protecting yourself from fraud means protecting your future. And that is something worth fighting for. Together, we can stand strong against Medicare fraud and keep our golden years truly golden. Bivix Wealth and Insurance Solutions, together with Secure65 Health Plans, where seniors thrive. We are your senior advocates, Alicia Alcano and Monet Swan. Come be a part of our community, Secure65 Health Plans. The Love and Trust Tour and the Reassurance Tour are going on right now. Join us. We are the vision. We are disruptors, and we're changing the way seniors do business. Become one of us. We are your community, and we are here for you. No senior should ever enroll in Medicare with a stranger. Call us today at 213-394-8885 or 833-300-4968 or email us at info@mybivix.com. Secure65 Health Plans, where seniors thrive.